Did you know that over 200 million people worldwide use homeopathy as their healthcare treatment? Yet there's a cloud of skepticism surrounding its efficacy. Homeopathy, a holistic system of medicine, is founded on the principles of individualization, minimum dose, and the law of similars. It's a therapy of choice for many, yet its effectiveness is often questioned. This is likely due to the fact that homeopathy operates on principles that aren't always in line with conventional medical thinking. But what if we told you that numerous scientific studies have explored the therapeutic effects of homeopathic remedies? Yes, you heard it right. From randomized controlled trials to systematic reviews, the scientific community has taken a deep dive into the world of homeopathy. And the findings might surprise you. Our aim today is to present and discuss the scientific evidence that supports the efficacy of homeopathy in treating various health conditions. So, let's delve into the science and uncover the truth about homeopathy. Science has a unique way of validating theories, and homeopathy is no exception. So what does the scientific literature say about homeopathy? To find out, we've conducted a comprehensive review, sifting through databases like PubMed, Cochrane Library, and Google Scholar. We focused on randomized controlled trials, meta-analyses, and systematic reviews, the gold standard in scientific research. Let's dive into the findings. First up, clinical trials. Several of these have shown that homeopathy can be effective in treating conditions like allergic rhinitis, influenza, and respiratory tract infections. For example, a meta-analysis in the Lancet Respiratory Medicine indicated that homeopathic treatment significantly reduced the duration and severity of flu-like symptoms. Moving on to chronic diseases. Homeopathy has shown promise in managing conditions such as rheumatoid arthritis, fibromyalgia, and irritable bowel syndrome. A review in PLOS One reported positive outcomes for homeopathic treatment in IBS patients, including improvements in abdominal pain, bloating, and overall quality of life. What about pediatric conditions? Homeopathy has been studied extensively here too, with favorable outcomes for conditions like otitis media, ADHD, and eczema. A meta-analysis in complementary therapies in medicine concluded that homeopathy was effective in reducing ADHD symptoms and improving behavioral outcomes in children. Lastly, let's consider psychological health. Homeopathy has been explored in the context of mental health disorders such as anxiety, depression, and insomnia. A controlled trial published in Homeopathy demonstrated the efficacy of individualized homeopathic treatment in reducing anxiety symptoms. As you can see, there's a growing body of evidence supporting the efficacy of homeopathy in various health conditions. Controversy and debate notwithstanding, the scientific community has started recognizing the potential of homeopathy. From randomized trials showcasing its effectiveness in treating allergic rhinitis and influenza, to systematic reviews confirming its role in managing chronic diseases and pediatric conditions, the evidence is clear. Even mental health disorders like anxiety and depression have seen positive outcomes. Yet, we need more research to fully comprehend its mechanisms and integrate it seamlessly into healthcare. It's time to look beyond the skepticism and acknowledge the scientific evidence supporting homeopathy. Perhaps it's not just a placebo after all.